Thank you very much. Let me introduce myself. My name is László Balkányi. We will make a round of introductions first. So, well, obviously, this has to go on first with the panelists, with the panel members. And let me greet, and it's my honor to greet our guest, Major Cheng from Taiwan, and also my colleagues and friends here, Dr. Kemenesi and Dr. Lafferton. They will introduce themselves, and I will ask everybody to pronounce his or her name, because sometimes it's not that easy for us to do it properly. So let's start the discussion. Let's start the introduction with Major Cheng, and I would like to ask you to introduce yourself now from the perspective of this pandemic, because that's what we will talk about today. We will talk about the post-pandemic world, and you have survived in Taiwan, and as we have survived everywhere elsewhere on the world, really spectacular, so to say, phenomenon, the pandemic, which influenced all our life. So the word is yours. Please introduce yourself, and then we will make the round around the table.
Ladies and gentlemen, I'm the mayor of Taiwan. I come from Taoyuan. My name is ChengWen-tsan. Taoyuan City is home to the international airport in Taiwan. We are an island, so border control is very important for us. It's crucial. And in the last year or so, as we fight against the pandemic, Taoyuan plays a very important role. In 2020, Taiwan enjoyed a very long period of very quiet period. We didn't have any domestic cases, but in May this year, we saw a domestic outbreak. Currently, in Taiwan, over the last 18 months, over 16,000 people contracted COVID, and 839 people died of COVID-19. And in our city, 949 people were infected. But this is against a population of 2.7 million, so the rate is still very low. In our city, only 26 people died from COVID-19. So you can see that the numbers are very low. In Taiwan, we're trying to drive up vaccination rate. Currently, 50% of the population have received the first jab, and about 5% of people have received 2 jabs. So we are basically trying to drive up vaccination rate, and we hope that the rate will exceed 70%. Now, in the last 18 months, particularly around this time, as I mentioned, we had a domestic outbreak. So I think the Taiwanese people are even more wary. Here, everybody wears a mask, and you also have to leave your contact information wherever you go, and you also have to disinfect your hands, etc. Whether you go to school, you go to shops, you go to your company, you have to do all this. And Taiwan is medically advanced, and our hospitals also came up with new measures. For example, we have a national health insurance card, which has a chip. So when you go to a hospital, we have to scan the chips. And if you have to be hospitalized, then we will conduct a PCR test to ensure that no one is infected. And also 10% of the wards in the hospitals are now negative pressure wards. So this is a way for us to be able to accommodate people who need COVID treatment. And whoever comes to Taiwan from abroad, they have to go through 14-day quarantine. They also have to be tested. This is a PCR test. So on the day of their arrival, and at the end of the 14-day quarantine, they also have to do a PCR test. And in between, they have to do a quick test. So in total, 3 tests. In Taoyuan, we have about 30 quarantine hotels, about 4,000 rooms, and a quarter are reserved for flight crew. So I think this is a very important policy as part of our efforts to fight against the pandemic. Currently, whenever a person is infected with COVID, we do a contact tracing, TOCC history investigation, and also we'll isolate everyone who is related. Recently, 3 people, including 2 pilots, were infected. And now we also tested about 10,000 people. So this is why we were able to contain the outbreak. So basically in Taiwan, we use precise contact tracing. We also use technology to curb the spread of COVID-19. So in recent weeks, every day, only a handful of people are infected, but I have to say that life is not yet back to normal. We still have restrictions regarding indoor and outdoor gatherings. And we also impose quite rigorous controls in terms of mask wearing. So we basically have a mask mandate. And later on, I'll also share with you some of our policies in terms of our long-term care and so on. Thank you.
Thank you very much for this detailed introduction. We would be happy to come back to some of the important issues you have mentioned, but first I would like to probably finish the first round of introductions. And I'm very happy to announce that we have here with us now also Dr. Agis Tsouros from WHO, if I may say so. And I would like to give the floor to him for this kind of brief introduction of himself and his understanding of the pandemic situation. Briefly, we go around and then we come back to these social economical issues that are in front of us in the post-pandemic world. So, Dr. Tsouros, the word is yours. Mr. Chen. Okay, so we don't hear you, unfortunately. Please try to unmute your mic, Dr. Tsouros.
Okay, is that okay?
Great,
now?
Absolutely. Okay. Thank you very much. So you are on.
Okay, good morning to everybody. I'm actually connecting to the conference from the Vienna airport. I'm very happy that I managed to find an empty conference room in the lounge. So, but you may hear some announcements, so don't be surprised. So, I'm very happy with the title of this meeting and the event, the Budapest Forum. I'm Agis Tsouros. I have worked for 3 decades at the WHO, but specifically to the theme of this meeting, I should perhaps let you know that I was a director of policy and governance for health and well-being at a European office, which includes inequalities, determinants, national, but also local health policies. And I was also director of the Healthy Cities program. So I have also worked for a long time extensively with mayors, with local governments. Now, in my brief introduction, I was trying to think what would be useful as a useful first input. And I would like to just draw 2 parallels. The first one is before the pandemic, if you ask me the question, what is the future of healthcare? What is it that becomes an emerging priority in the way we organize our health systems? The prevailing issues in the 21st century were the following. One, and the most fundamental one, is universal coverage. that in today's world, we must ensure that everybody, no matter who they are and what economic or geographical situation they may be, they should have access to the best care that they need. The second is patient-centered care, is the emphasis on the person, the emphasis on all those determinants of a person's health and well-being, and that accordingly health systems which increasingly moved also towards the community. So the concept of home care, community care has become much more prominent and important. Then it's the whole idea of prevention, investing in prevention and health promotion. Our systems, as we know, are suffering greatly. Leaving aside now the pandemic, the real pandemic in the world is non-communicable diseases, is chronic diseases. And with the aging of the population, of course, it is a very big challenge for everybody if we continue to get ill from heart disease, cancer, and other diseases, respiratory and so on, diabetes. This can literally collapse our system. So investing in health promotion and prevention is hugely important. And the last but not least, I only picked a few issues, is the idea of preparedness and response to the possibility of public health crisis. As I said, if you asked me before the pandemic, what is the real threat in the world, I was going to tell you the real threat is going to be climate change and everything that is going to be linked to climate change, which is going to affect not only because of emerging diseases, because of these movements of the relationship between the animal world, the humans, and the physical environment, but also the disasters, the physical disasters, the heat waves, flooding, and so on. And then we come to the pandemic now. And I would like to preempt this by saying that perhaps the pandemic is a kind of dress rehearsal of what is to come in the future. And I'm not trying to be a Cassandra and to say that, this is the world to come. But everybody is concerned today that we may have come to a point of no return in certain areas. So what is the post-COVID healthcare? All those issues that I mentioned before are very valid. But we learned something more than that. That we actually had overestimated the capacity that we had to deal with crisis. We found out that the worst price was paid by the most vulnerable and underserved. We found out that the real action to have success in dealing with COVID had to take place at the local level, at the community level. The ability to know and map out before a pandemic who are the vulnerable people. And vulnerable are not only those who are above a certain age. Vulnerability has no age limits. It is socioeconomic. It is related to culture. I mean, let's face it, we're talking about healthcare in the future. We should not forget that the social landscape of today is very different to what it was before. What do I mean by that? Migration. An average local doctor in a city before would deal with a very homogeneous clientele. Today, this is not the case. You have people who come from all sorts of cultures. How do you respond to that? So we need to have those reflexes now that we learned the hard lesson. We need to understand what it is solidarity at the global level, at the national level, at the local level. Fairness. We know how many doctors were faced with tough choices. where there were no respirators available for all, how do you make decisions? With what criteria? Who should get it and who not? These are amazingly difficult decisions for a doctor who has learned to be fair and to do their best for their patients. And lastly, the idea of community resilience. In other words, the ability of our communities today to withstand, to respond, to adapt, to survive, and to come out with new strengths from situations such as these, which have tested everything. They have tested our systems, which were not very well prepared. We had them on paper that everything was okay. The international health regulations, many countries were ticking the boxes. Yes, 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 we do all that. But in reality, these were not systems that were really prepared to deal with such a situation. So the future of healthcare, lastly, is exactly that we have to ensure equity and universal coverage. We have to invest into local systems, not only nationally based systems. We have to organize our communities to be part of what is the provision of healthcare, social support, and to remember always that investing in primary healthcare, patient-centered care, and community-based systems will pay a lot of dividends for the healthcare in the future. And always remember climate change. These are the two words that we are going to remember for long, and not only us, but the generations to come. Thank you very much.
Well, thank you for giving us the broader perspective. It was really very interesting and a good introduction. But let's go on with still with the introductions as planned. We have a little bit of delay in the whole discussion, so please allow me to show you when it's time to join, time to give the floor to the other colleagues. I will show you this time sign in the future, and that will show you that we have to jump on. We are a little bit delayed. So let me introduce the next panelist, Dr. Lafferton, Assistant Professor Lafferton to be correct, and please introduce yourself and your position, your take on this shortly, and then we will go on. And we will come back all the issues discussed before.
Thank you. Thank you. So my name is Emese Lafferton, and I'm teaching at the Department of History at Central European University, this university. Just very briefly, what historians and social scientists may bring to the table here is precisely what grasps the essence of these epidemics, is that they are extremely situated, but also complex phenomena. So in history of science and medicine, we try to teach to what extent science doesn't stand on its own, but to what extent it is embedded in a social, in a social and cultural context. Technology is not something purely existing, but is a very malleable item. There are all kinds of actors that we tend not to think about, but epidemics such as COVID actually shows how many different actors, how many different levels and perspectives we may have and we should have in order to have successful attitude and management of these diseases. So it's about the situatedness of knowledge, but also technology and also space of action that we need to see and discuss. So I'm going to also just bring one or two historical examples to the floor that we can discuss later. Spanish flu, polio, especially Spanish flu was used as one of the original models for understanding COVID. I'll talk about differences which actually undermine this idea, but I will also argue that nevertheless, examples are good to look at and comparisons are essential. So all those details later. And last remark that I would also like to come back to is to what extent pandemic, and this is also part of the job of the social scientist to emphasize to what extent these epidemics not only reflect but also reinforce social inequalities of all sorts. So we can come back to that later. Thank you.
Thank you very much. And now, Assistant Professor Kemenesi, please introduce yourself.
Thank you very much. I'm happy to be here and welcome everybody. I'm Gábor Kemenesi. I'm a simple virologist. I am one of the few experts in Hungary working with emerging infectious diseases. So I'm here with the message of science. And I'm here with the message, you already know, I'm here with this message from first hand. Let's learn from this pandemic because we have others standing by the doorstep waiting for us. So I think this brief introduction is enough about me. I'm a scientist, and I'm happy to be here. Thank you.
As usual, Gábor was very modest because I know his important role in fighting these epidemics, in also for the public sharing the information, what is really important. Well, let me finish the introduction circle with myself. My name is László Balkányi. Myself, I have medical background, and what is relevant for today is that for more than a decade, I had a position in the European Center of Disease Prevention and Control. It's a European Union agency in Stockholm, whose job is to prepare the member states to fight such outbreaks, epidemics as we are in now. Actually, it's a pandemic, as we all know, and also to collect and redistribute and process data, facts, so that our decisions, the hard decisions that, for example, Major Cheng faces day to day in leading a city, has to be based all on facts and all on evidence. And this is what this agency is doing, helping the member states, helping the European Commission. So that's my background. Actually, we already, in these introductory remarks, we have already started to discuss the first aspect of this panel meeting, and it is connected to the general message of this conference, which is all about sustainability and about the future and the role of cities in this aspect. So let's try to go on and give some remarks regarding this, so to say, the social economic aspect, which is in this case, if we look at this from the perspective of the pandemics, there is the issue of simply the survival of the cities, the business continuity. And I think that's an area where all the facts and all the important messages that we heard from Major Cheng are showing that a country can defend an epidemic with traditional epidemic control measures even before the vaccination, and now vaccination helps us further on. So we have the good example of Taiwan, actually one of the best around the world, concerning the facts and the numbers to fight the epidemics. And let's now focus on the cities, on this kind of survival, on this kind of business continuity. Before we can really go into that, maybe it's worth to go back a little bit to the past. And I would like to ask a little bit about the lessons that we have learned from really large-scale pandemics, like the polio or like the Spanish flu was. What can we learn from this, adding to the current experiences for the future? I asked this from Emese.
Thank you. I mean, I'll just first say a couple of facts about the Spanish flu, as some of you may not know some of the details. So we know that this was one of the first massive modern global pandemics in the world, and it erupted in 1918 and had its course for 1.5 to 2 years in 18 and 19. And it had several waves, just like COVID has, not of equal lethality. It basically struck people, the younger generation, so people between their 20s and 40s. Interesting parallel here again, the fact that that this may suggest that there was an overreaction of the immune system of these young generational people, and basically that was So the body was itself attacking the lungs, for instance, which again, I think that there are shows some parallels in terms of the pandemics. What we know is that it really took lots of lives. There's a huge variety of estimations. So these range between 20 million deaths to 100 million deaths. So it's immense. And one of the reasons for these uncertainties is the lack of recording. So that, for instance, is already a major difference. Recording 100 years ago was very different than today. What we also need to think is that that was precisely the end of the First World War. So the general population of Europe and the world was very different in terms of health and nourishment. It was really hitting, the pandemic hit a population or populations whose general health was very much already kind of worn down. We also have to think to what extent public healthcare system at the time was, at the end of the First World War, was demolished. There was lack of doctors, lack of technologies, lack of medications. So we have to take all these into consideration, especially when we think about COVID from a very kind of Western and European perspective today. So when we have very different system of and level of technologies compared to the end of the First World War. So there are actually many, many more differences. There was very different healthcare system, very different social attitude to health at the end. But I also want to suggest to why, I mean, what was also crucial is that not only lack of medications, but also the entire lack of vaccine. Vaccination was not yet a viable solution. So one of the reasons for its lethality, but also its fastness, the way it could ravage through societies globally, was because social distancing was one aspect that they could deal with and live with, but we should think about the mass migrations of peoples around the newly redrawn borders, national borders. Also think about the movement of military army troops returning from the Far East to America, to Europe. Think about people walking through continents, Europe partly, to get home. So basically, social distancing was almost out of question, and there are some wonderful historical images, wonderful but also terrible historical images, how some of the shipment of troops shows extreme crowdedness on aboard. And so obviously some people started using masks. So we also have images of people wearing masks, but that was a very different situation. I just want to mention cognac as a viable solution to kind of kill the germ, recommended by doctors. And also there are some stories about aspirin being widely overdosed and overused, which actually led to fatalities at the time. So lack of knowledge or different knowledge at the time means very different outcomes. So these are just a couple of kind of parameters where we can compare. Now, does it help really? I'm sure that it does, because we just have to see and look at a pandemic from many angles with very different perspectives. And what I want to suggest is that usual historians of medicine look at pandemics which kind of end with a closure, as if there was really a closure. And now contemporary historians suggest that we have to look beyond the pandemic, the sort of say ending, because first of all, it may resurface. Diseases, epidemics may resurface on other parts of the globe. Lack of or insufficient vaccination programs may actually bring back different pandemics, such as coughing.
Which one do you
which
want
cough?
to tackle?
Sommarköhögés.
Whooping cough.
Whooping cough, but also measles. Some of these eradicated from the northern countries and global north. It has been coming back. But I also want to suggest that we have to look at what happens afterwards. We have to think about not just those who died, but also those who survived with bruises, with their bodies already diseased or disabled. So there is a very important literature coming from disability studies where there is a big kind of emphasis on what happens to people who survive but have to live lives with very severe disabilities afterwards. So the point is we have to look further than just the closure as if it had been successful and kind of great. And just one other reminder, for instance, HIV, it is not closed. That story, that pandemic story is not closed yet, right? It's still open-ended, although it has been going on since the late 80s. Should I finish now and then just leave more time? Polio is another example where we can talk more about politics as well. And
we can come back to these issues.
Thank you very much.
Thank you for the historical perspective. And before we jump to a little bit different aspect of medical technical voyage to the future, I would like to go to make a little round on this, what we have learned so far. And I would like to go back to Major Cheng and ask him about what they have learned from their really successful fight, as we have seen from the distance, Taiwan's fight. So what you have learned from these pandemics? You have been well prepared, you had a preparedness process, you had a pandemic plan, not like many countries around the world, and it was implemented and it led to really good numbers. So please tell us about what you want to change. How do you want to do it in the future for the next pandemics?
Thank you. In 2003, Taiwan was hit by a SARS outbreak. So the CDC here already came out with a national plan. And all the cities in Taiwan also had to come up with our own plans. So at the beginning of the COVID-19 pandemic, we had 11 major hospitals in Taoyuan. And at the time, we already doubled the number of wards available. We also made available N95 masks, respirators, and so on. So we actually had 3 months of inventory. That means that our hospitals will be able to deal with patients as they came in. So this is actually a national plan. And as I mentioned earlier, we are home to the major international airport. And in Taiwan, we have universal healthcare, which is called the National Health Insurance. And in terms of the payment, the insurance premium for every citizen is about 25 euro per month. And when people go to hospital, they have to pay 5 euros per visit. In Taoyuan, for over 65s, our government actually pays the national health insurance premium for the over 65s. So I think that we have a very unique national health insurance system. In terms of infectious diseases, anyone who contract infectious diseases, whether they are Taiwanese or foreign nationals, the treatment will be paid for by the government. And COVID-19 vaccines too, it's the government that pays for the vaccine. In Taiwan, we have more than 23 million people. And we also have about 800,000 foreign nationals, including 700,000 migrant workers from Southeast Asia. So during the pandemic, for the 700,000 migrant workers, we also have to take care of their health needs. So we provide information in several languages. We also provide them with masks and COVID-19 vaccines. So foreign nationals are also included in this network. And in terms of our effort to fight against the pandemic, the first line of defense is actually our national border. The second line of defense is hospitals. So as I mentioned earlier, when a person comes to Taiwan, he or she has to go through 3 tests. And they also have to stay in quarantine hotels. And quarantine hotels only serve people who come from abroad. If people in Taiwan have to be quarantined, their employers still have to pay them. And if the employers are not able to pay them, the government will foot the bill. So whenever there is a community outbreak, we really have to build a defense in our community. We are a democratic country. So of course, we have to rely on technology, and also we have to take a more human-centered approach. We do use mobile phones to try to do our contact tracing in order to find out where a person has been in the last 14 days. We also use mobile phones to try to do our TOCC history investigation. But of course, we also have to protect personal privacy, and the data are destroyed after a certain period of time. So we do have restriction measures, but these measures have to be justified. Otherwise, the people will not want to cooperate. So during the pandemic, we did impose restrictions on visits to hospital and also visits to long-term care institutions. This is to protect patients already in hospitals and also residents in long-term care homes. And in terms of screening, we actually have a large number of screening stations, and the screening is also paid for by the government. And this is so that we can try to identify people who have been infected. I believe that we have a very high health care standard. So whether we are talking about mild cases or severe cases, all these patients are treated in hospitals. This is why we have also accumulated a lot of experience, which will help us prevent severe cases. We do see that COVID-19 may affect older people more than younger people. So we also provided vaccines to residents in long-term care facilities. Now in Taoyuan, in my city, we also provide taxis free of charge to people who are over 65 so that they can receive their vaccine. So far, about 82% of over 65s have already received 1 jab, and they received mostly AstraZeneca and Moderna vaccines. We are aiming for a 75% coverage. Now, Taiwan is a new democratic country, and our people are very law-abiding. So I think our public health initiatives are very successful in that the public are willing to cooperate. In terms of caring for the underprivileged, as I mentioned earlier, we have universal healthcare. So people who are of lower economic or social status can still access healthcare. And I would say that during the pandemic, more and more hospitals are starting to use remote medical services. So we use telemedicine so that people who live in remote areas can also receive care. We also can remotely monitor people's blood oxygen level. And as I mentioned earlier, big hospitals were closed to visitors. But in communities, the smaller institutions, we may allow certain visits as long as the people have received the vaccination. So of course, the pandemic has far-reaching impact. And I believe that the impact will continue well into the future. And we hope that in the post-pandemic age, our health system can also recover. Now, during this period, about 200,000 migrant workers who would have come to Taiwan were not able to come because our borders were closed for a certain period. But now we have about 200,000 caregivers from Southeast Asia. We have these vacancies basically, and we hope to bring them to Taiwan as soon as possible. And I think the use of technology is also crucial because technology will enable us to conduct very precise contact tracing. It will also help us do better PCR tests. And also telemedicine will require the use of technology. So I think in the future, the use of technology will be even more relevant. Now, in our hospitals, before people come into the hospitals, they have to be tested. If they are to be hospitalized, they will have to be tested, and it will be a PCR test. So I think we have to protect hospitals as well. And within the hospitals, we also have to separate different groups. For example, you have a floor dedicated for a certain group of people. This is to avoid cross-infection. So I think infection control will be a very important issue for hospitals in the future.
Thank you very much for all these details, and our understanding obviously improved on that. We see that how important is the local issue, how important are the local issues that are tackled in fighting the epidemics, but there are also global issues. And here I would like to jump to Dr. Tsouros to have your opinion on how do you see how the international community, the big organizations, WHO, my own one, the ECDC or others, have reacted, and what you see as new initiatives for the next pandemic. And following your answer, we will jump to the technical area, and then I will ask Gábor to talk about this. But first, Dr. Tsouros, please give your understanding of the global future now that we have heard about the local fight.
Yeah. I have to apologize because when you asked me to introduce myself before, I thought it was also an introduction, my first words on the topic. So that's why I went on a little bit. So you already have a part of my answer, but let me be concise on your specific question and the role of cities. And I will say it almost in bullets. First of all, what we know for some years now is that cities have a tremendously important role in health, equity, and sustainable development. And if cities have that role, then mayors have a very important role. City councils have a very important role. And that's why in WHO, we talk a lot about governance for health and sustainable development at the local level, at the national level, and at the global level. So it is important to embrace and to consider in strategic terms the cities as important stakeholders in the fight against the diseases and other hardships that may hit population. So that's number one, the role of cities. And that's why the WHO launched 30 years ago the Healthy Cities movement. So this is one aspect. The second aspect is that many of the strategies that somehow are becoming now increasingly the Bible, the basis of policy development in the world are highly relevant to the local level. Most importantly, the Sustainable Development Goals. You cannot talk about development today in the world, whether you talk about health, economy, equity, environment, anything you will talk about, you have to make a reference to the 17 goals of sustainable development, which is otherwise known as the United Nations Agenda for 2030. So that's very important. There is, in fact, they are all relevant to health. They are all relevant to local level. There is, of course, one, I believe is the number 11, which is very specific for the cities. And that's why there is a new term now that is increasingly being used, which is called city diplomacy, or city diplomacy for health and sustainable development. Why? Because many of the interests of local cities, of local communities, have to be advocated and be presented in global fora. It's not an issue that there are some people who somehow make important decisions that relate to cities, and then city people, city mayors, are not present. So the idea of becoming more vocal jointly from the local to the global, that's why there is the expression also of glocal, is very important. So WHO pays extreme importance to the role of local governments. And in the post-pandemic period, as I said in my previous introduction, this has become very evident. Who is going to talk about resilient communities? Who is going to talk about sustainable health systems? Who is going to talk about social sustainability with all the social diversity of our communities in cities? Who is going to talk about environmental sustainability? So that's why we talk about the social determinants of health, in which WHO pays huge attention, because ultimately they are responsible for the inequalities we have. So in conclusion, what I want to say is these are not separate worlds. The local, the national, the global are closer than ever, because the agendas are interconnected, and there is no way that you can today effectively, in a successful way, confront any of these emerging challenges without the involvement, the engagement, the commitment of local governments, of mayors, of local communities. Thank you.
Yeah, thank you for this very convincing presentation of these issues which are in front of us. I think that we earned a bit of understanding in these social economical aspects in our first round of discussion, but we have limited time, unfortunately, so we have to jump a little bit to the second sustainability issue, to the second perspective that we would like to discuss today, for which we have another 11-12 minutes, so we have to be aware of the time limits. But I think that in order to solve all these issues, all these wicked problems, we can use and we can rely somewhat, at least, I believe a lot, on medical technological development, on the disruptive technologies that are coming in and will change epidemiology, will change control, infection control, and so forth. And in this aspect, in this area, I would like to ask Gábor to give us a little bit of introduction in this area like molecular epidemiology, digital field epidemiology, all those things that are coming and that will make life easier in a kind of next round that we are all facing at.
Thank you. These technologies, I mean, they make our lives easier, but they can help us to understand these kind of emerging challenges as well. Compared to the first SARS epidemic, we have the technology to rapidly understand the virus, to rapidly act with vaccines, with mitigation measures, to harmonize these kind of actions. But what happened, and this is partially my experience during this outbreak situation, most of the countries faced a big problem, namely research centers were moved towards to public health mitigation, because in most of the countries, public health authorities didn't have the capacity to understand these kind of challenges, to make some kind of research, mostly research-based actions. So I strongly suggest to everybody to think about this situation. We have a lot of public health authorities. We have the bureaucracy behind them. We have a lot of capacity in these kind of public health institutes, but we don't have the research capacity. And research capacity is necessary to understand these kind of emerging challenges. And research capacity is necessary to act, to adapt to these kind of challenges as well. So it will be extremely important to build up these kind of capacities in the public health part all around the world. Because during this outbreak situation, our research center was nominated as the National Coronavirus Research Center. So basically we did a lot of job related to general understanding of epidemic situation, sequencing, a lot of things which cannot be done currently in the Public Health Institute because they don't have the capacity, they don't have the people to do this. So we really need to build up this kind of capacity, just as we build up the best technologies in the hospitals. We have to build up a strong and adaptive Public Health Institute all around the world. And just one more addition, actually two more additions to the previous discussion. I believe that the first line of defense must be the transparent and collaborative actions over nations. So pandemics and infectious diseases are not national problems. They are absolutely global problems. So we have to work together, and working together not just means that countries have to work together and share knowledge. And why do I say this? Why do I tell this to you? Because researchers has these nodes. We have these nodes. We have connections all around the world. We have connections in other countries. And I'm not sure that all the public health authorities has these kind of capacities behind them. And this is highly important to face these kind of infectious disease related problems. And I think that was my basic ideas here. Thank you.
Yeah. I would like also to add some perspectives on this technical aspect, which were already mentioned by Major Cheng. I'm talking about personalized medicine. I'm talking about telemedicine. I'm talking about new technologies that allow personalized care, even in the isolated situation that comes up in a pandemic when somebody is quarantined, somebody is out of the immediate reach of medical care. So all these new technologies are coming in, and I think that they dramatically change our future, how we can react to an epidemic, to an outbreak in the future. And I sincerely hope myself, using the experience that I have survived in the many years in ECDC, there is already a difference how the world reacted, for example, to the Zika outbreak in Southern America, and how now we responded to this outbreak, to these pandemics. It is much quicker these days how the genetic information, for example, is passed and shared of the virus. And it has allowed us really a dramatic speed of developing good vaccines. So I believe that the technology is one aspect that will help us in the future when we talk about post-pandemic life and we talk about the future and the sustainability of health services. They are closely related to these capacities that has to be taken into account. and used in a kind of violent way to fight the virus in this case. Do you have any more comments, Gábor?
Yes, I'm not sure that everybody knows that these days now we have the technology better and cheaper than ever to understand even infections by infections. We can sequence a complete viral genome in 8 hours nearby the hospital bed. So we have the capacity, but we have to build on this capacity in the future. And we have to, most importantly, we have to integrate this knowledge in outbreak mitigation in the future. And this can be done currently, I mean, in Hungary and in most of the countries, in research centers, which is not the best thing. We have to integrate this kind of knowledge and capacities into the public health institutes. And one more idea, and I had this idea and we all forgot this. This is really important, the communication. We can spend a lot of money to sequencing machines, to hospital beds and everything, but if we don't communicate it to the people and we don't build up public trust and we leave the ground empty, fake news, fake information will fill this ground and it can heavily disrupt all our efforts during a pandemic situation. Thank you.
Thank you very much. Some words?
Just
yes.
Just a brief question. To what extent can these kind of miraculous new technologies and be transported to other parts of the world? To what extent it's really just still a great story of the West and developed countries? I mean, as far as I know, and please correct me, 80% of the vaccines so far has been for COVID has been distributed in the West. So what about long-term inequalities and the real global nature of these?
Those are really, really very important issues, and it just shows that our little panel meeting that will have to be concluded in 4 minutes is by far not enough to discuss all these aspects that just came up during this discussion. However, I would like to grab the opportunity and to ask a closing remark from all of the colleagues. Make just around your most important message for the future of fighting next pandemics. Please, Major Cheng, start to this closing round with some comments.
Humans are now faced with this most challenging pandemic, and we need transnational or international cooperation. Now vaccines and medicines are mostly at the hand of the rich countries or advanced countries. We definitely need to think about this from a human-centric point of view. And before we open up our border, before we resume to the pre-pandemic level, we believe that we have to increase the vaccination rate in most countries, and we need vaccines, we need medicines. So I believe that the cooperation between cities, between different political parties is very, very important. Sometimes we may see different opinions between experts at different fields. We have to be able to sit down and talk rationally and to come up with a feasible solution. I believe this is a very important attitude. Of course, because of the pandemic, we're going to increase our investment in the medical field, including the vaccines and the drugs. Taiwan is very advanced in the semiconductor sector and also in the medical field. So in the future, we're going to increase our investment, which includes the investment in the biochips and also in AI. We're going to use more AI in our medical imaging. So we will increase our investment in these fields. As for our national health insurance, we have a good system here, but we hope that our people can use this system even better. For example, they can log into the system and they can see their medical records, their vaccination record, their prescription record, etc. And they have the right to know. So we really want to make this information available to all people. Because of the pandemic, our lives have been changed a lot. I believe there are more areas of cooperation in the future. Thank you.
Thanks for the closing remarks. And now the floor is to Dr. Tsouros.
Thank you very much. Just I will use 4 words that were mentioned by the colleagues. The first one is investment. I think from now on, we really have to think of public health in the same way we think of the defense of our country. We have to invest in public health systems, functions, infrastructures in the same way that we invest greatly sometimes in aeroplanes and fighters and whatever. This is there is a lot at stake. Yes, because many people will say, oh, well, is the next pandemic going to come in the next 100 years? Well, I'm not Cassandra, as I said before, but I think pandemics are going to be more and more common. That's number one. Number two, it was mentioned 2 words by Gábor, transparency and solidarity. Let's face it, this world really showed how, and you know, we have been talking about masks. I think I will use the metaphor that masks were dropped in this pandemic because it became very apparent that there is no transparency, and especially when it's so much at stake in the world, we cannot afford not to be forthcoming when there are emerging dangerous virus, as it was the case, and there is no solidarity. I'm sorry. There is no solidarity when the West is rushing to get all the vaccines. And of course, now we have the phenomenon where we have countries in Africa with 2 or 3 or 4%. How are you going to stop mutations of the virus if there is such large populations in the world who are unvaccinated? And the last word is the key role of local governments and local communities, investing in resilient cities, in active local governments, and in understanding the importance of inequalities and vulnerabilities, because that's where the problem, that's what all the viruses of the world will hit first, those who are disadvantaged and underserved. Thank you.
Thank you very much. And now, Emese, some closing remarks?
Just following up on these last words, and also to kind of underline again what I was probing with my last question a few minutes ago. So I'm just suggesting that wealthy countries really have to take responsibility to a far greater extent than they are doing in terms of distributing the kind of wealth, knowledge, technologies they have accumulated partly through decades of you know, kind of using other areas of the global world. Prosperity, yeah. So basically, we do have responsibilities that we have to face.
Yeah.
I would like to ask everybody, please invest in each other. Please, it's not enough to build up your strong healthcare system because it won't protect you from a global pandemic. Please invest in Africa, please invest in other countries, and please learn from science. Learn from science how we communicate, how we share results, how we make our decisions during our research. And please, finally, this is my final idea, integrate science into your decision making. Thank you.
Well, these are very clear messages. So what I can add to this, a bit of very similar message, is that the phrase that was mentioned previously by Dr. Tsouros, the glocality, we have to think at the same time globally and locally and act like that. And we have to introduce in our fight against the outbreaks, against the pandemics, the subsidiarity. Decisions has to be made where the information is and where they have effect. That's how cities are very important in this issue. And probably this is where we really have to stop, because we are delayed somewhat and the next meeting will start. And I want to thank you for all the participants, the meaningful discussion, even if we didn't have the chance to go to all depths of the issues. I hope that the community who were present here, or the audience, had a chance to have some understanding of the future, how we will fight the pandemics, and what the role of the cities will be specifically. Thank you very much for your attention.